Welcome to our latest Rocky Mountain Cancer Center's Medical Oncology Watch program. We are pleased to have Dr. Gerlinde Tynan with us today. She is our breast cancer surgeon, and she works out of our Longmont, Colorado office. And she's going to be presenting about our lymphedema prevention program that has just been started in that office. We're very excited to have you, Dr. Tynan, and thank you for spending your time with us. As a reminder to anyone who's watching this, please feel free to put any questions into the comments, and we are happy to try to take those live at the end. And then we'll also say for future viewers, if you would like to put in a comment question in there, we'll be able to get those back to Dr. Tynan and get them answered as well. Thank you so much.
Great. All right. Thank you, Jessica. Good afternoon, everyone. I would like to talk with you today about lymphedema and probably more, or as importantly, about our lymphedema prevention program. I will point out that it's a prevention program, not a management program, which is pretty amazing considering where lymphedema has traditionally been a chronic issue that we have to manage. So without further ado, we'll get started. So lymphedema is considered one of the most dreaded consequences of cancer survivorship. There are nearly 17 million cancer survivors in the United States, and 1.8 million new cancer patients are diagnosed every year. Now, not all of those patients are at risk of lymphedema, but for those that are, about 1 in 3 will develop lymphedema. What puts people at risk for lymphedema are surgeries or treatments that are targeting the lymphatic system. So for instance, for breast cancer patients, having the lymph nodes under the arm removed put folks at risk for lymphedema. Some of our pelvic surgery patients who have lymph nodes removed in the groin area can develop lymphedema. Lymphedema is a condition that causes significant swelling, and this is due to the buildup of fluid in the soft tissues when the lymphatic system is damaged or blocked. And if this is not caught early, it becomes irreversible and then becomes a chronic, lifelong condition. So our prevention program is using new technology called the SOZO device, and we'll obviously get into that in a little more detail. We're the only facility in the northern Colorado area that offers this technology. And this has been shown to reduce the risk of developing chronic lymphedema by as high as 95%. And this is just one part of our comprehensive approach to breast cancer care. We have a comprehensive team, including breast surgery, obviously, medical oncology, radiation oncology, breast radiologists, our genetic risk assessment team and counselors, management of patients who are at increased risk of types of cancer, nurse navigation, a survivorship program, physical therapy, social work, financial counselors, and now our lymphedema prevention program. The way that this works is patients who are at risk of developing lymphedema are tested prior to starting their therapy. That way we have a baseline measurement to know where they are starting. And that way then when they have their assessments afterwards, we can see whether or not they're developing lymphedema. So let's look at this all a little more closely. So those of you who may be familiar with lymphedema will probably recognize some of these modalities that have been used in the past for monitoring for lymphedema. So volume measurements basically were done with a tape measure or water displacement, measure the amount of basically increase in size of the arm or the leg based on their pre-treatment measurements. It's not very accurate. You can't actually tell whether it's fluid gain within the tissues or perhaps just a little weight gain. And it can't actually measure the increase in fluid until there's enough of it to show up on a tape measure. So in other words, until there's actual clinically significant swelling, will we be able to find it. There are other imaging methods. So on the bottom left there, this is an MRI showing some soft tissue swelling. This is pyrometry, which uses an infrared light to scan the tissues. They are, again, not terribly accurate. And then the ones like the MRIs or the CAT scans are rather expensive. Plus, if you've ever had an MRI, getting an MRI on a regular basis is also not very pleasant for the patient either. So this newer technology uses what we call BIS, or bioimpedance spectroscopy, all right? And so the way this works is a mild electric current is passed through the body, and the actual current is less than, about 10 times less than the amount of current in a AA battery. So it's nothing that you can feel, it's not harmful. And this electric current, then the technology and the software can take these different frequencies and get measurements of what we call, so ECF is extracellular fluid, or fluid outside of the actual cells. Intracellular fluid, which as it sounds like is fluid inside the cells, and total body water. And there's a certain ratio that in a normal limb is respected. And so limbs that have lymphedema have an increase in that ratio, usually of the extracellular fluid. The results of this are then converted into what's called an LDEX score. And this indicates where a patient is on that scale. So normal range and normal LDEX is in this, within this bracket here, with the green being normal, the yellow being kind of beginning to be a little bit high, and then the red being high, meaning increased fluid buildup. So this is what the machine looks like. Basically, it looks like a scale. You have bare feet and bare hands that are placed on these metal plates, and that's how the little current can go through the body, all right? And again, it can detect lymphedema in the what we call stage 0, and I'll show you what that looks like. It's non-invasive. The test takes 30 seconds to do. It's FDA approved, HIPAA compliant, and all of those things. So it's pretty amazing. There are currently over 600 SOZO devices in clinical use around the world. So it's new technology, but we have a lot of places now that are starting to use it. And you'll note over here that there is not a whole lot in our area. In fact, like I said earlier, in Northern Colorado, we're the only one that's using this. So these are our stages of lymphedema. So stage 0 is when it's what we call subclinical. What that means is you wouldn't really sense that you have extra fluid. It's not something we would feel that we could find with a tape measure. It's not something where your rings or gloves are tight, but it is something that we can pick up on the machine because it can pick up such small amounts of overload fluid, if you will. Stage 1 is what we call pitting edema, and that's usually where folks start to feel, you know, my rings are tight, my watch doesn't fit anymore, my arm feels a little bit swollen. If we catch it here, we can still, you know, have pretty good results as far as preventing any further fluid buildup or lymphedema. But when you get to these stages 2 and 3, this is irreversible. And so you can see the noticeable arm swelling here on this lady. And then here, of course, it's called elephantitis, and this is absolutely non-reversible. So, you know, for the stage 2, these are the folks who have to wear, you know, a sleeve or a gauntlet all the time to get their arm back to normal. Unfortunately for these folks, they've gone even beyond that. So we want to prevent getting here and even here by catching it when it's in that stage 0. So as I was saying, so chronic lymphedema is preventable if it's caught early. And so if we look at this little chart, this is showing us stage 0. So again, no obvious swelling, not swelling that we would pick up on an exam, but swelling that we can see with the machine. So of the 25 patients who were caught at this stage 0, all of them were able to be resolved of their fluid swelling. And the same here, 25 out of 25. As you can see there, nobody went on to have chronic issues. Of that stage 1, 17 patients were detected to have it. 15 of them were resolved, meaning it went away, but 2 ended up being chronic and it never goes away. So while this is pretty good, this is the ideal. And of course, when we're down here in stage 2 and 3, all of those folks continue to have problems with lymphedema. Now, people say, well, how long do I have to worry about getting lymphedema? So lymphedema, most of it develops by the 3rd year. So about half of folks, if they're going to get it within that first 12 months. The rest of people, about 75%, if they're going to get lymphedema, get it by 3 years or 36 months. However, as you can see, it can develop at any time. I have seen patients that come in 10 years after, lymph node surgery and have developed lymphedema. But again, most of it's caught early, and so our detection efforts are much more are more robust at this early stage than later, because obviously if we catch it sooner, we can get rid of it so it does not turn into chronic lymphedema later. Okay, so the PREVENT trial is the largest randomized trial for lymphedema prevention. And this was a trial that was evaluating the detection of lymphedema at that early stage 0 and seeing if we could prevent folks from progressing to chronic lymphedema. So they compared 2 groups of patients, one group who had just a tape measure following the size of their arm, and the others having the SOZO, or the bioimpedance spectroscopy system, following them. So we had greater than 1,000 patients, 10 centers across the US and Australia. And these were breast cancer patients, all right? So those who had lymph nodes removed. And this is, the study is still ongoing, but this is the first 12 months or the first year result. And so patients who were tracked with the SOZO, all right, or the LDEX score, had a 95% reduction in the progression to lymphedema. So again, this is the largest randomized trial focused on prevention of lymphedema. And we found that, again, 21% of patients were detected in that stage 0 and were able to be then 95% of them decreased down to no lymphedema. So very, very exciting study. There are also some other studies other than the PREVENT trial, which have been done, that also show that this monitoring and this catching of lymphedema in its earliest stage is effective. So here's a group breast care specialists, 206 patients total. 20-something of them were determined to have that early stage lymphedema. They underwent treatment and 100% success. So none of them developed chronic lymphedema. In this one here, out of 188 patients that they followed, 48 or so developed that stage 0 lymphedema, and they were able to get 83% of them to not have lymphedema. Only a few went on to chronic lymphedema. So you can see that these numbers are good. I mean, even at your lowest, 73% decrease is huge when you're considering a life-changing event such as lymphedema. Now, this is kind of another way of looking at things. So what we want, of course, is to catch patients here in this green box, if you will. And this is where we have that opportunity to detect and reverse the lymphedema. And this green box, or this time frame here, is before actual symptoms develop, because typically what happens, a patient goes in for their cancer follow-up, they say, gosh, I've noticed my rings are tight, or my hands feel really swollen. So that's when their symptoms begin. They get their referral to physical therapy. That takes a little bit of time. Therapy begins, and in this time frame, sometimes it gets to be too late and we can't reverse this. If it's caught a little earlier, we can. That's kind of that yellow zone we saw earlier. But really, if we can catch patients here, all right, before they even develop symptoms, then that's our real opportunity to prevent lymphedema. So we use what's called the test, trigger, and treat approach, all right? And so again, 95% reduction in lymphedema progression using early detection with the LDEX. So this is the SOZO with LDEX technology. So patients come in and are seen. They undergo this little test when they come in for their regular follow-up visit. The machine puts out a reading, and I'll show you this in a little more detail in a second. And then if there's a point where they go into that red zone, okay, then that's when we can go ahead and get them started on treatment. And after usually 4 weeks of compression garments with these or a glove, they go back down into the normal level. So again, fast test, FDA cleared. And here's the key. Detects changes in fluid as small as 2.4 tablespoons. All right, so This woman who's having her limb here checked, her right upper arm, if her arm has 2.4 tablespoons of increased fluid as compared to the other side, then we know that she's developing lymphedema, and we can catch it before it goes to those other more advanced stages. So the LDEX score, again, is a ratio of the extracellular fluid accumulation versus of the affected limb. So if you had surgery on your right side, so the right arm versus the left arm, all right? And so we see here, so this is before treatment started. So before surgery, we do a baseline measurement and shows within that green is that normal range. And then 3 months later, there's another measurement which shows, okay, it's still within the normal range. You know, it's gone up a little bit, but until it gets to be higher, 6.5 points higher than the baseline, that's when we say, okay, so she came back in 3 months after that and had a test, had her measurement done. And this shows that here she's gotten into that red zone. So this is when intervention is initiated. In other words, she started on compression therapy for 4 weeks, comes back in 4 weeks, and lo and behold, back in the green. So, and people will stay then in that green, but we keep checking. If it bumps up again, then 4 weeks of compression therapy and down. And typically then people will stabilize out over time and remain in the green. And so this is the prevention with the compression garment. So compression sleeve, compression gauntlet. So 12 hours a day, doesn't have to be worn 24/7 for 4 weeks, and then come back in for another test. So the way this works then in the office for new patients, so a patient who's going to potentially be at risk for lymphedema are identified. So in other words, preoperatively before undergoing lymph node surgery, there's a pre-treatment baseline score, so we know kind of where you're starting. And then you have your treatments, be it surgery, radiation, some sort of chemotherapy actually can affect lymphedema as well. And then for those years 1 through 3, again, most lymphedema, 75% of it is detected within that first 3 years. And so every 3 months for the first year, there's a test done. Oftentimes it's linked with your visits with either your surgeon or your medical oncologist. Sometimes it's just a quick, pop in to the office, have a quick score taken. It's not even an appointment per se, but we follow that every 3 months for that first 3 years, then every 6 months for years 4 through 5, and then, after that annually. If there's an elevated LDEX score, again, 4 weeks at home with the compression garment. If the score is normal, just continue the monitoring. Non-invasive, very simple. Detection of lymphedema at its earliest stages is recommended and approved by these important organizations, the National Comprehensive Cancer Network, the National Accreditation Program for Breast Centers, of which we are a part, Association of Physical Therapists, the National Lymphedema Network, Oncology Nursing Society. So this is recognized to be very, very important in the quality of life for our patients. So a quick summary. 1 in 3 at-risk cancer survivors will develop chronic lymphedema. And at-risk means patients who have had treatments, radiation, things like that to their lymph node, what we call basin. So typically under the arms or in the groin, okay? Lymphedema is caused by damage to the lymphatics from those cancer treatments, surgery, radiation, chemo, as mentioned. Again, it causes swelling and heaviness in the affected limb. And if untreated, it interferes with quality of life because of this change to the arm, and also increases the risk of infection in the arm, which can be very serious. And lymphedema can be prevented in almost 95% of patients by regular use of this 30-second SOZO test. So patients in our program are measured prior to cancer treatment for a baseline score, and then every 3 months are monitored for the first 3 years, every 6 months for the next 2 years, and then annually after. If lymphedema is detected, home compression therapy is used for 4 weeks, and then people are reassessed. And this is part of our comprehensive approach to breast cancer care here at the Longmont office of Rocky Mountain Cancer Centers and Rocky Mountain Breast Specialists. We're the only ones in Northern Colorado to offer this technology. And This is my colleague, Dr. Robinson. She's our medical oncologist, Dr. Weeks, who does our radiation, and myself. So just wondering if anybody had questions.
Thank you so much, Dr. Tynan. We have had one question that's come in, and they were wanting clarification, saying, it's my understanding you have to have measurements prior to treatment. So someone who maybe is in treatment or is past treatment, could they still benefit from this?
Yeah, and of course we have patients that are, before we had this technology, right, that are in the middle of treatments, and so we'll do kind of a baseline to see where they're at currently. I mean, it does compare to the other arms. You do get a pretty good sense of if the two arms are similar, right? And so if that's the case, then we can put them on the maintenance program. And we have had a couple of patients where we found that that first measurement does already show some lymphedema. So even if we don't have the preoperative one or the pre-treatment one to compare it to, we can certainly start a baseline at any time and then intervene if needed.
Okay. And then another question we got is, how often are those with no lymph node surgery diagnosed with lymphedema?
So people who have not had lymph node surgery?
Correct.
Radiation in the lymph node area can also cause lymphedema. Typically people need a reason to have lymphedema. It's not something that most people who have not had some sort of intervention on the lymph nodes get.
Okay. All right. So one of the things I was thinking about was, the standard treatment is 4 weeks for those patients who are identified to get the sleeve, and then they come back in. How often do you feel 4 weeks is enough time, or are there times when you say, we're going to put you in a sleeve for a little bit longer?
Yeah, it kind of depends on how bad the lymphedema is at the time that we find it. Folks who come in and have been getting, have not had lymphedema and then all of a sudden develop a small amount, usually the garment for that 4 weeks takes care of it and bumps them back down into that green area. If it's a little more severe to start with, it may take a little bit longer, but typically it's still, in that reversible area. So the sleeve and the gauntlet is a temporary measure, not a permanent one. Okay.
We've had another question asking, is it seasonal? Notice the swelling of feet in the summer. She's actually a lung cancer patient.
Yeah, that's a great question. With this newer technology, we're interested to see what we're finding as far as any trends like that, right? Because in theory, if we're going to pick up an earlier onset of lymphedema, do we find maybe that it's going to be triggered by, hotter weather, colder weather? We're not really sure. One of the things that we've kind of found, which is a little bit interesting, is some of our patients who are undergoing what's called neoadjuvant chemotherapy. So in other words, they're having chemotherapy before surgery. We found a couple of them that just as they're coming off that chemotherapy, we're doing their preoperative measurement, and their levels are a little on the high side. So we've been like, okay, why don't you come back in a couple of weeks and let's see if we get a new baseline, and those numbers have gone down. So we do see some fluctuation depending on the treatments. So, I'm not sure if we'll see a seasonal effect, but that'll be very interesting to know.
Okay. Another question we've gotten is, other than swelling, are there any other symptoms that should be looked at or watched for?
Sure. Swelling is the obvious one. Sometimes it's not so much swelling that people feel as they feel heaviness, okay, of that arm. A lot of times it's more of a feeling of tightness, or like I said, rings that aren't fitting anymore. The watch isn't quite fitting. Redness of the arm could be an indication of cellulitis or an infection of the skin due to the lack of that lymphatic fluid being taken out of the area. But usually you'll see that along with swelling.
Okay. Tingling, I mean, sometimes the numbness, does that factor into lymphedema?
Yeah, tingling, heaviness, numbness.
Same thing. Okay. All right. Yeah. One of the things that I thought about was, do we know for sure, is insurance covering this? How is that being handled?
Yeah, that's a great question. So Medicaid and Medicare are covering this. Some of the commercial payers are not. We expect that with the recent publication of those 12-month results from the PREVENT trial, that more commercial payers will come on board. What we are offering for our patients is we want them to be able to have this technology available to them. If their insurance is not covering it, we are not going to charge them for it. So we just feel that it's just an important part of their whole cancer care that we don't want, insurance or monetary issues to get in the way of that.
Okay, all right. We did have one patient asking who was a lung cancer patient. I know we had kind of specifically talked about this, and you're a breast surgeon, but can lymphedema affect other cancer patients, not just breast?
Again, most of it is, typically we see with breast cancer patients, obviously because of the lymph nodes. Melanoma patients often have lymph nodes taken as part of their staging. Patients who have had pelvic surgery, there's a lot of lymph nodes in that pelvic area, either in the groin or even further deeper inside. So some of the gynecologic, ovarian cancer sort of things. Lung cancer kind of depends. If oftentimes lymph nodes can be taken in the case of lung cancer. Anyone who has had cancer treatments, we know that some of the taxane chemotherapy agents can cause some lymphedema. I think would be wise to pay attention to any of those types of signs. If they have, their lung cancer is on their right side and now their arm is feeling swollen or tight or tingly or heavy, to bring that to the attention of their provider. I mean, we're happy to see folks who have had, surgeries or treatments elsewhere and offer them this technology. So it's a great program, and we're really excited about the way that we can help our folks up here in Northern Colorado.
Thank you so much, Dr. Tynan. It doesn't look like we have any other questions that have come in on Facebook Live. For anyone who is watching this afterward, if you have questions, please feel free to put them in the comments, and we'll try to get an answer to you. We do have somebody who was saying that they're a Thornton Rocky Mountain Cancer Center patient. Do they need a referral? I think you can, I would say, check with your medical oncologist on that, and they can help you get in with the Longmont office, not a problem. You can even call it up to scheduling at Thornton, and they can help kind of connect you on that. So,
yep.
Thank you, Dr. Tynan. Thank you, everyone, for your time today, and we'll see you for the next Medical Oncology Watch.
Great. Thank you.